Good afternoon, ma'am. My name is Erica Tuaza from BSN 1B. So now I will be performing assessment in appearance, mental health, skin, and hair of the patient. So the first thing that I will be doing is to introduce myself to the patient. So, ma'am, I am Erica Tuazon, your student nurse, and I will be assessing you on your appearance, mental health, skin, and hair. So I already washed my hands and provide privacy to the patient. Close the doors, curtains if there's any. May I know your name, ma'am?
I am Michelle Tuazon.
How are you today?
I am fine.
And then after that, observe body build, height, and weight in relation to the client's age, lifestyle, and health. Observe the client's posture, gait, standing, sitting, and walking. Also, observe the client's overall hygiene and grooming. Relate this to the person's activity prior to the assessment. You should also note body and breath odor. After that, observe for signs of distress in posture or facial expression. Note obvious signs of health and illness. Also, assess the client's attitude. Note the client's affect or mood and the appropriateness of responses. You should also listen for quality, quantity, and organization speech. Listen for relevance and the organization of thoughts. And then after all of that, you should document pertinent findings in the chart. So now, we will be proceeding on assessing the client's skin.
So, na ba kayo mga recent allergies, ma'am?
Wala.
Recent bruises,
Wala.
swelling, burn, mga skin problems,
Wala.
dryness sa skin,
Wala.
irritations.
Wala.
Now, inspect uniformity of skin color, assess edema if present, let the patient sit with leg dangling, palpate skin over tibia, run finger pads over area pressed and check for indentation. You should also inspect, palpate, and describe skin lesions, apply gloves if lesions are open or draining. Observe and palpate skin moisture, palpate skin temperature, compare 2 feet and 2 hands using the back of fingers. You should also note skin turgor, and then after all of that, document lesions on body surface diagram, locate by indicating the lesions in the drawing. So now, the last one, we will assess the client's hair.
So, any recent use of hair dyes?
Wala.
Color sa buhok?
Wala.
Kanang nag-curl-curl, baka sa buhok?
Wala.
Straight?
The first thing to do is to inspect the evenness of growth over the scalp. Next is to inspect hair texture and oiliness. Also, note presence of infections by parting the hair in several areas and checking beyond the ears and along the hairline at the neck. Last is to inspect amount of body hair. And then document all the findings and note if there is any abnormalities.